Hi guys, I'm going live now with Dr. Laurie Goldenberg from Smile Squad Kids. Stay tuned. We're excited to talk about all things children's dentistry today. And any questions that you have, please feel free to ask us. And we'll be able to answer all of your questions. So Dr. Laurie is just joining me now. Hi, Dr. Laurie.
Hey, how are you?
That's a nice purple background you have there. Are you in work?
This is work. This is my wall.
Beautiful.
Yeah.
So we'll give it a minute for a couple of people to join us. But how about let's start first of all by introducing yourself.
All right. Hi guys. I'm Laurie Goldenberg. I'm a pediatric dentist at Smile Squad Kids Dental at Bathurst St Clair. We're neighbors with Bitehaus. We work closely together. It's nice to have this kind of relationship with another dentist. If ever we need like help or anything, we're always here. And I'm happy to chat with everybody, answer questions, anything.
Excellent. So as some of you may know, Bitehaus is located on St Clair West. Dr. Laurie's just down the street from us. So any concerns that we have with your children, we will refer them down to Laurie. So we do see lots of families at our clinic, but sometimes it's important to also see a pediatric dentist. A number of different reasons or different complex situations that it's going to be much better suited to your family to see a pediatric dentist, both for your comfort and for their expertise and knowledge. So it's very important that general dentists work closely with specialists and have a great relationship with them, so that you get that continuity of care for your family for treatments like this. So tell me about a couple of reasons why you might get a child referred over to you from a general dentist. What kind of things do you see?
Okay, so when patients are referred by general dentists, it's usually so there's two main reasons. One is if there's a high volume of treatment, meaning that there are lots of cavities and the dentist feels like the child may need to be in a different environment, something like a little bit more geared towards children, or if they need some form of sedation. We offer all levels of sedation, from laughing gas to oral sedation, which is basically giving them a drink to help them relax, to fully asleep. So a lot of people are referred for those reasons. So it's usually either for like the cooperation, if they don't feel like it's a good environment for them and they want them to see a specialist, or if there's a high volume of treatment and we manage it that way.
And definitely, like in a general dental office, it's not going to be catered towards kids necessarily. So when you go to somewhere like a pediatric dental office, well, especially Smile Squad is like so catered for kids. Like it's all kids in mind.
Yeah.
You got a lot of everything there. What kind of experience have you got for the kids when they arrive?
So first of all, our staff are amazing. Every single person who works here is obsessed with kids. And we hire people because they're obviously very skilled and talented, but a lot of it is personality, and they just have to have that thing that makes people feel comfortable and happy. So I think that's probably our number one thing, is the people that work here are incredible. And I think that when people come in, they just feel like they're welcome. The kids see other kids and they feel happy, and they feel like, oh, well, other kids are here and they look fine, so I'm fine. As soon as they walk in, they see like this awesome toy machine where they can pick a prize, and that's really exciting for them. They have like lots of different choices. We like to give kids as many choices as possible so that they feel like they have as much control as we can give them. We strive for that. Then when they come in, I can actually show, let me see if I can turn this around. So this is actually where we see our kids. And so this is a cool toothpaste menu that we have, so they can pick their flavor of toothpaste. We always have a welcome sign so that the kids see, this is for you. The kids can see their names. And we have this cool toothpaste menu. So just, trying to make it colorful, fun, as kid-friendly as possible. When I worked as an associate in other places, sometimes I felt like I just wanted the kids to feel like this was a place for them, and we wanted to alleviate as much anxiety as possible. So that's why we designed the place like we did. And also another thing that's pretty cool, you probably have this too, are the TVs on the ceiling. So the child is sitting or lying down, and while they're lying down, they can pick whatever Netflix show they want to watch up here. So that's pretty cool. I found that since we opened and since we have had the TV on the ceiling, we've even had to use like a lot less sedation, because kids just get so into the TV that, like, for some kids, you can do anything you want as long as they're watching their show.
Yeah.
So it's nice to have that. I think those are like probably the main things that make people feel welcome. There's iPads around. Of course, we're not using them right now because we can't really have anything like that going on at the moment. There's a play structure that we can't really use right now. So there's things that we've had to cut back on because of COVID, but hopefully one day we'll be able to enjoy them again. And even if we can't, there's still like, it's just the feeling, and the staff and everything that will make them feel welcomed.
Yeah. I know that patients of mine have loved the welcome sign on the, always come back with that picture or like a little prize, little ball or something like that they got. Yeah. And then they just talk about it all the time, It's the tiny little like that have a huge impact on children.
Thank you. We see that all the time too. Thank you.
Yeah. So you touched on this a little bit already. One of the questions that we got this week was, my child is very nervous about going to the dentist. What kind of options do they have?
So first of all, like, just because a child feels nervous in one place doesn't mean necessarily they will feel nervous here. Again, because like all the things we talked about, sometimes kids come from another place and the parents are shocked because their kids are totally happy and like opening their mouth and letting us take x-rays where they couldn't do that before. But there are some kids who are just like definitely very nervous. And for some kids, especially if they have a large volume of treatment that is needed, we will talk about options for sedation. So laughing gas, oral sedation, like a drink to help them relax, or going fully to sleep. Those are options too. And then we have like more conservative things that we can try. Like if a parent is not into sedation, let's say, like we have silver diamine fluoride that we can use to sometimes buy a little bit of time until the kids are a little bit older. So we like to always work with parents in their comfort zone. So we're never going to like push a specific type of treatment modality. We give the parents all of the options that we can think of, and let the parents choose, and we go with that.
See what the best fit is. And I think I agree with you on that one. Like, kids can be very nervous coming from a particular office, and you don't even know necessarily what the reason is for that. But they picked up on something that they didn't feel comfortable with, and they come into this environment and they can just feel super comfortable, and it's just straightforward dentistry from there. But the actual vibe that they're getting is huge. And obviously, you're extremely talented with children, so you automatically will put them at ease anyway, without doing anything, but just by being yourself.
I think so. And like we've even noticed now that we're wearing all of our PPE and our masks and our visors and our gowns, like the kids can just sense, they can just like, they're still fine. They're very comfortable. They can just sense that we're caring and gentle, and we're not like, I feel like they know we're not going to hurt them. So I think that's what makes them feel comfortable, really. Like all these other things are just an added bonus, but kids are very smart, and they can sense danger, and they can sense kind people, and they know that
in seeing them too, that you had a comfortable vibe.
Yeah, for sure.
Okay, so you put a little picture up of this, and you said this is one of your most common, if not the most common question that you get.
Yeah, so the shark teeth. So it's surprising because it's like we obviously have been getting a lot of emails because the offices have been closed to normal treatment. So a lot of people have been emailing their concerns or questions. So the most common one is shark teeth. So these are adult teeth that are growing in behind the baby teeth, and the baby tooth hasn't fallen out yet. So it's first of all, it's very, very common. Sorry?
Tooth in front of a tooth.
A tooth in front of a tooth, basically, yeah. So it is very, very common. Normally, we'll recommend that you encourage your child, obviously with clean hands, to play with the baby tooth a lot, to encourage it to fall out on its own. And most of the time, it does fall out on its own, but sometimes it doesn't. But we normally will wait until adults same height as the baby tooth and it's still not very wiggly, then we may decide to take the baby tooth out. It's a pretty simple procedure. Again, it's not something that we can do right this minute because of the COVID restrictions, but we're, you know, just encouraging people to try to like manage these things at home. And just, I think just like hearing that it's not going to affect them in the long term. Like if you leave a tooth like that for a little while, it's okay, because as soon as we get that baby tooth out, the tongue will push the adult tooth forward into position. So even if it takes like 1, 2, 3, 4 months for us to get that tooth out, it will not negatively affect their dentition.
Not have impact on that adult teeth.
Right.
We got a little question in the messages. Not sure if you can see these, Laurie.
Yes, Christina.
Yeah, Christina.
I have a little one that loves his pacifier.
Cat leave.
Okay, so pacifiers. I don't love pacifiers. I think that they're okay to use for babies when they're babies. I would try to use them as sparingly as possible. So only when really, really needed. So, you know, if you need it for your sanity to like calm the baby down a little bit, if you need it for sleep, that's okay. But you just want to keep in mind that this is something that you want to try to get rid of as soon as possible also. So the less reliant they are on the pacifier, the easier it will be for you to get rid of the pacifier at the right time. And the sooner you get rid of the pacifier, the better. So we used to recommend like by 2.5. And now I'm even starting to recommend getting rid of it a little bit sooner if you can. Like, again, unless you really need it for your sanity, that's also very important. But pacifiers can have a negative effect on the bite. It can narrow the palate. It can make the teeth jut out. It can cause orthodontic issues that may not be like naturally fixable once you remove the pacifier, depending on the severity of the damage. So if you can not use it or use it very, very sparingly, that would be ideal. But it's not like an absolute no-no. So, you know, you just want to try to time it and get rid of it as soon as you can and try not to have them as reliant on it.
And the number of hours in the day and all of these.
So, right. So it's the time and duration. It's the duration and the force with which they're using the pacifier that causes the effect. So if they're sucking on it very lightly, they may not be as affected as a child who's like, you know, Maggie Simpson, like, you know, you hear her sucking on that pacifier. It may be a little bit less of a problem, but it's a little hard to predict who's going to have an issue and who's not. But we do see a lot of bite changes, and even sometimes it can affect, because it narrows the palate, and the palate is also the floor of the nose. So having a more narrow palate can also have an impact on the nasal passage and possibly breathing. So that's also something to consider.
Yeah. I'm very similar to this. What is the best way to get rid of thumb sucking in a 3-year-old?
So thumb sucking is a little bit different. Thumb sucking is a little bit more of a natural habit, I think, than pacifier. It's also like the thumb is a lot thinner and shaped differently. So at least in my experience, I found that the pacifier is easier to get rid of, but the pacifier, prolonged use of it, it has more of a severe effect on the teeth, I find, than a thumb sucking. And most kids do stop sucking their thumb naturally at a certain point. So usually like JK, SK is when we find that kids naturally will stop or very much decrease thumb sucking. For example, my daughter, who's now 6, literally you could not get a picture of her without her thumb in her mouth until she was like 4 or 5. And she just like on her own, you know, of course we talked about it, but I never pushed it so much. And it's just like being in school, like she doesn't want to do it around her peers. And so for a lot of people, it's a natural thing. So I try to tell patients not to worry so much at this age about thumb sucking. But if you are really worried, there's something called a T-guard that you can order online. And I'm pretty sure it comes with a money back guarantee, or at least it did. And it's something that is pretty non-invasive that you can put on the thumb that will help to remind them not to suck, or they won't be able to put their thumb in their mouth.
A little cast?
Yeah, it's like a little silicone piece that goes over the thumb, and it wraps around the wrist. Just in a T-guard. I think it's like tguard.com or something like that. So that's an option if you're really eager to get it to stop the thumb sucking, but it does usually naturally get better.
What do you think about the ones that are kind of like this kind of a thing?
So same deal, right? Like this is something that prevents the elbow from being able to bend so that you can't move I kind of like the idea of the T-guard a little bit more. I think that like bending your elbow is a little bit maybe meaner. I don't know, but it's really whatever works. You know, if that works for you and your child and you want to try it, go for it. I don't think, you know, if it's not making them like very, very upset, you could try that too. I don't even know what I don't know what those are called because I've never recommended them, but patients have used the T-guards with success for sure.
Awesome. So what happens if a child injures a baby tooth? What should they do?
Okay, so it really depends on the type of injury. So the best thing to do is to contact your dentist if it happens. You can let the dentist know what happened. We, you know, a lot of dentists right now are doing teledentistry. So you can send over an email with the photo of, you know, the injury, and they will be able to advise you. During normal circumstances, if someone injures a tooth and they're worried about it, we just tell them to come on in and we can quickly look at it and let them know what to do about it. But now with the restrictions, we're doing a lot of stuff over teledentistry. So if there's something that you're concerned about, whether it's an injury or whatnot, you can always like call or email the dentist and they can let you know if they think it's a concern, if you have to come in. But, you know, there's so many different types of injuries in kids' teeth. So it's really hard to just say like, you know, if this happens, do this. It's really just like, if you injure the tooth, contact the dentist, let them know what happened, and then they can advise you.
Yeah.
Does that answer it?
Yeah, for sure. I mean,
okay.
I would say the same thing. You know, in usual times, I would just tell them straight to the office. We'll fit them in, we'll fit it out.
Yeah.
And during these times, you know, it's a real mixed bag because it all depends on how much movement. If the tooth is still there, if they've knocked it out, you're not putting it back in again in the baby tooth. That's
exactly right. Yeah. So you don't reimplant baby teeth.
Exactly, because you're worried you might touch on the adult tooth. But other than that, you know, I've seen some unusual injuries within my mom group of friends, who some of them might be on this, that Laurie has seen for me, where the baby tooth pushed way up, and I thought, I don't even know what Laurie's going to say when she sees this.
Right.
And it has naturally come back down into place.
Yeah.
So there's really, you know, unusual circumstances and interesting things the body can do. It's not always that you have to take out that tooth.
Oh, for sure. Like we only take out baby teeth or teeth in general if we must. So a lot of the times we let the body, you know, naturally run its course and see what happens. And I don't think that there's a need to, in certain circumstances, of course, but most of the time with baby tooth injuries, there's no need to rush to do anything. You can like give it some time, because once you take out a tooth, you can't get it back, obviously. If a tooth needs to come out, we can take it out another time unless it's causing a problem right now. So I like to let the body do its thing. And if it heals and things are going well, we just monitor. And we do keep like a close eye on injured teeth because they can become infected. But if something becomes infected, then we deal with it at that point.
And kind of similar to that, the next question was, my child's tooth has gone gray. What do I do?
Right. So a color change. It's common for an injured tooth to turn color, to become like gray, yellow, black. It doesn't necessarily mean anything bad if it turns color. Sometimes the color goes away and sometimes it doesn't. If you have, so a color change on its own is not necessarily a bad thing, but if you have new pain, so for example, you injure, a child injures their tooth and everything's fine until like, you know, 6 months later, it starts to hurt. Or you notice a bubble or a swelling in the gum sometime later. Like those are concerns, but a color change on its own is not necessarily a reason for concern.
If a parent notices a child going black or gray, do you like to come in and have a look at it?
Not necessarily. Like, you know, usually if we've seen the child at the time of injury, or we've corresponded somehow via email or something like that. So we warn them that a color change may happen, and if it does, not to worry, and only to let us know if there's new pain or a swelling. And we're normally seeing the kids every 6 months anyway. So we always check injured teeth at their 6-month visit. So no, like I wouldn't necessarily have them come in specifically because of a tooth color change.
Okay. Yeah. Have you seen quite a few of those teledentistry during this time?
Meaning like?
I've had a whole handful of new gray teeth.
Oh, yeah. Yeah, no, of course. Like injuries have also been a very popular concern, and it's really, this is one thing that I really like because it's so. I mean, all of it. It's like a very easy thing to address, and once you explain it to a parent, they're not worried anymore. So you can help manage their anxiety in a very, very simple way. And teledentistry for something like that is so useful because it doesn't, like, they don't have to come in for this. They don't have to come in for shark teeth right away. So I think that these are things that we may end up like implementing even once the COVID restrictions change, that like some things can certainly be managed by not coming into the office. You save people time, and if something needs to be seen, we'll see it, but it's not necessary to see every single thing sometimes.
Yeah. We talked about this before, but a very hot topic for very young children is tongue ties and lip ties. So if, for example, a patient or a parent has a newborn baby and a tongue tie is seen at the hospital, you know, they do that little screening, check out for a tongue tie. But what happens after that? So if a parent is having trouble nursing, what kind of suggestions do you have, or what are you looking for with the tongue tie and the lip tie?
So normally when a baby is coming to see us for a tongue tie or a lip tie issue, they're being referred by either their pediatrician or a lactation consultant. Sometimes it's word of mouth, but we really like the baby to be assessed by a lactation consultant before we see them, if possible, because sometimes the lactation consultant can like tweak the way that the nurse, like tweak the positioning or do something to help make nursing easier. So I like to have them seen first, just to make sure that there's nothing else that can be done non-surgically to help with the nursing issue. So once they've been referred to us, they've usually already seen an expert in lactation, and they're referring because they think that a tongue tie or a lip tie is causing a problem. So we'll do we do a history, we find out if there's pain, if mom's having issues with nursing, what the issues are, if there's gas, like we go through a whole bunch of questions that we ask the mom, and then when the mom comes in, we can also examine the baby and we look for tethered tissue. So we look for a tongue tie, we look for a lip tie, we lift the tongue to see how much it can lift, because just because babies can stick their tongue out doesn't necessarily mean that they can lift it up. And lifting it up is really the motion that's needed in order to efficiently extract milk from the nipple, because it's the mid portion of the tongue that has to elevate in order to get the milk out. So a lot of people, if they can stick their tongue out, they're like, oh, it's not tied, or you don't see the tie, but that doesn't necessarily mean that there isn't a tie, because there could be what's called a posterior tongue tie, and that could really impede on nursing as well. So we look for those things. We like have them suck on our finger so we can see what their suck feels like. And if we think that there is a tie that is interfering with nursing, we'll discuss the option of releasing it with a laser.
And if they have a lip tie at the top, so this is this little area here, what concerns could you have there?
So a lot of people come in with lip tie concerns, not necessarily referred by a lactation consultant, but just because that's something that they have noticed. They can see, they've been online, they've seen other kids with pictures that look the same as theirs. So a lip tie, so there's a couple things. It can interfere with being able to thoroughly clean the front teeth, because it holds the lip really tight to the teeth, and some parents will find it very difficult to brush that area, and kids can develop cavities there. They don't always, but it's a possibility. But often after we show them the lip tie and we teach them how to brush around the tie, their risk shouldn't be any higher than someone without a lip tie. So if we think the lip, sorry?
It's not always something that needs to be dealt with.
No, definitely. Like most of the time, I would say we recommend not releasing it, because it does often recede over time as the babies grow. My kids had lip ties, and like now they're nowhere to be seen. So I definitely don't think that they all need to be released. But sometimes, like if it is interfering with the latch, if the baby's not able to properly flange their upper lip over the nipple, then we may recommend releasing it. And in older kids, if they're developing cavities in this area and we're treating here anyway, we may decide to release the lip tie so that the parents have a better ease of brushing. And as the kids get older, there are some kids who have a lip tie that does not recede, and it attaches in between the teeth, and sometimes it can cause a gap or a diastema. in between the teeth that, you know, people don't love that all the time. So we can release that piece of tissue to allow the teeth to come in closer together at the right time. But this is not something that needs to be done in a baby. I like what happens. I like to see how they develop. Go on its own. It proceeds on its own, and we don't have to do anything about it.
Yeah. So the next question that I get a lot, and that somebody asked this week, was about their children grinding a lot. So little infants grinding or younger children grinding. Is that something that they should be concerned about?
Okay, so first of all, it's a very, very common concern. We get tons of questions about grinding. I usually will ask, do you, like if a mom says this is her concern, I'll usually say, like, do you grind or does dad grind? And most of the time there's one parent who grinds. And if there's a parent that grinds, I'll usually tell them that there's a genetic component to grinding and that this child may end up grinding also. But the question is why? And I don't think anyone really knows exactly why kids grind. And it's something that I would really, really like to find out too. I don't know the answer to that. Like, some people think that it has in certain cases to do with airway, with it could if it happens during sleep, that it could be related to a sleep issue. But a lot of the times the kids are sleeping totally fine, and it's not like they're stressed out. It's not necessarily related to that. It's just something that they do. I don't know why. So they ask about night guards often. We don't make night guards for kids because they probably wouldn't tolerate them, and they're growing so quickly that you'd have to keep remaking them. So it's just something that they kind of have to tolerate for now. And some kids do outgrow it. Like, you know, sometimes it's a phase in babies, and that's totally normal. They're kind of like learning their new environment in their mouth. And sometimes as they get closer to age 6 or so, it tends to like taper off a little bit too for some kids, which would be great. But some kids tend to grind even past then. And those are the kids that will end up maybe using a night guard when they're older, unless we can figure out the cause and deal with it. Hopefully
ortho or something like that, and then maybe that helps at that point.
Yeah, it can.
I know that with our little infant, when he just had 2 teeth on the top and 2 teeth on the bottom, the grinding was out of this world violent.
Right.
But as he got more teeth in, a lot of it started to fade away.
Right.
It was so bad that he chipped his front tooth. He'd only had the tooth about 3 days.
Oh.
And he did already.
Wow.
Just a tiny bit, you know, but
yeah.
you can. And I thought, you know, geez, I get this question all the time from parents, and now I'm seeing it for myself.
Yeah.
And it's noisy, but
it's a scary sound. Yeah. Doesn't sound nice.
Yeah. So the last question I got this week was in terms of toothbrush choices for children. So do you recommend manual, electric? Is there an ideal age to switch to electric, or what are your thoughts on those kind of options?
So I think that, so they've done studies to show that manual and electric toothbrushes are equally as effective if used properly. So I think it really comes down to preference of parent and child. So if the child is excited about an electric toothbrush and will be more eager to brush with an electric toothbrush, great, use it. And I don't think there's a specific age, but probably not younger than 3. I don't think that there will be a huge benefit to using an electric toothbrush in like a baby. But as they get a little bit older, if they want to try it out and see how it goes, sure, go ahead. You just want to make sure that the head is an appropriate size. So they do sell some electric toothbrushes, some of the cheaper brands with like these massive heads. And those are not going to thoroughly clean the crevices in between the teeth. So you want to make sure that the head of the toothbrush is an appropriate size for your child. And if you're not sure, you can bring it into the appointment. Like I often tell families, they have an electric toothbrush, and bring it with you. Let's take a look at it, and let's make sure it's the right option for your child. And same goes with the manual toothbrush. You want to just make sure that it's the appropriate size and that it's not too big and not too small. And with the manual brushes, it comes with like an age recommendation. So if you follow that, you should be pretty good.
Yeah, I also find that with some kids, switching to the electric might be kind of a motivating step. So if they are at the age where they can kind of understand that, kind of like they're getting a bit bored of brushing and they're going through that phase, it's like a really nice.
For sure. And then they feel more like they're like mommy and daddy brushing the toothbrush.
And we're all in it together.
Yeah.
Fun.
Exactly.
Have you any other most common questions that parents tend to ask you, or do you think we've covered a lot of them?
I think we did cover like the most common questions. Flossing is also a big question. A lot of people ask, when should we start flossing?
Yeah.
So you basically should, there's not an age, like a baby with first teeth that come in may need to start flossing if they come in close together. So even if there's two teeth, those two bottom teeth, if they're close together, you want to start flossing them. Whereas there's some kids who have gaps everywhere in between their teeth and you don't need to floss. But just because a child has gaps in the front does not mean that they have gaps in the back. So you want to actually use it and try flossing in between the teeth. And if you feel resistance, that's an area that you want to make sure you're flossing every night, because it is very common to develop cavities in between teeth that are touching. And you won't see those cavities until the kids are older. When you take their first set of x-rays, you may notice cavities are developing in between the tight contacts. And it's very common for us to take a first set of x-rays on like a 3-4-year-old and find 8 cavities in between those molars. So, and then they'll start flossing. But if you floss before this happens, like as soon as they start to touch, you're going to really reduce the risk of those flossing cavities developing. They're very, very common.
Actually, what you touched on earlier that people may not know much about is this treatment SDF.
Oh, right. Yeah. So SDF is, I'm just going to plug in my phone because it's going to die. Okay. So SDF is, it stands for silver diamine fluoride. And it's something that we can use that is a very conservative treatment option to treat either very small cavities in between teeth, or sometimes bigger cavities that are open, because the SDF has to be able to penetrate through the cavity. So if it's a big open cavity, sometimes we can use SDF to treat that area. Or in between the teeth, we can floss it in between the teeth. So it's something that we either brush onto the tooth or floss in between the teeth. It takes like a minute to do, and it helps to stop the cavity from getting bigger. And I usually tell parents that it's something that we can try. It's conservative and easy. It doesn't work 100% of the time, but it does offer some benefit. So whether it's going to stop the cavity completely or it's going to slow it down a little bit, it's a really nice option if you're trying to buy time or if you want to try something more conservative. It's not an option for every cavity, but it's something that might be an option. So it's, if you're wondering about it, you can always ask your dentist if it's an option for you or your child. And my girls had cavities, 2 out of the 3, and I used SDF on their cavities, and I still had to go in and fix them after, but I think that it definitely helped to slow it down so that I could buy a little bit of time until I could fix them.
And for that, do you need to use any freezing?
No. SDF is, it's like you literally put it on like a little tiny micro paintbrush and you paint it onto the cavity, and it stains the cavity black. So the downside of SDF is that it stains cavities black. So cavities on the front, not beautiful. No. Again, it may be a good option for like a 15-month-old with cavities in their front teeth. And, you know, we want to buy time until they're a little bit older to put crayons on the teeth or something like that. Yeah. We'll make them look beautiful again. But for now, at least we want to stop it from getting big. So, but in the back, you don't really see it. So it's a really nice option for cavities in the back teeth too.
Yeah, it's a great option for kids who are nervous and, you know, no anesthetic, basically no drilling.
Yeah, and very, very quick and easy.
Very quick, yeah, and don't really feel anything. So it builds up confidence too.
Oh, for sure. And because we normally will apply SDF multiple times. So it actually gets the child into the chair multiple times for a very easy treatment that they're like, oh, this is pretty easy. It's not so bad. So then if we actually have to go in and fix the cavity down the road, they're already comfortable sitting in the chair. They're picking their show. They know the staff. It's like, it gets them comfortable with the whole environment.
That's really cool. That's really cool.
Yeah.
It's something that I think most of my patients don't even know about, and it's a great option. Yeah, such a good thing to come out of preventative dentistry.
It is really good. Yes, agreed.
So from me, that's all the questions I have. How do you feel, Laurie? Is there any other?
I'm good too. Yeah, if anyone has any questions that they think of later, they can always send me a DM or an email, or, you know, I'm always around to answer questions anytime.
Especially at the moment.
Especially at the moment. I like questions. I'm good with it.
So thank you everybody for watching. This was Bitehaus Live with Dr. Laurie Goldenberg from Smile Squad. Be sure to follow their Instagram at Smile Squad Kids. And as Laurie said, pop her a message if you have any particular questions that didn't come up today. Also, if you have any questions for Bitehaus, please message me, children, adults, whatever, any questions that you have there, we're happy to answer them. We are both seeing select emergency cases at the moment, so if you do have a dental emergency, please contact us to see if we can help. And that's it for today. On Thursday, I'll be going live with Stefania Palmari, and we'll be talking about early infant nutrition. That's 4 p.m. this Thursday. Be sure to join us then.
Awesome. Thanks, Ashley. Thank you. Okay, bye, everyone.